The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people with gum disease. With us, we have an expert on the topic. We're talking about laser dentistry today, Dr. Hudson. Dr. Hudson, welcome to the program.
Thank you very much.
Thanks for coming on the program. And very interesting. We've had a pretty interesting conversation prior to the interview. But before we get into today's topic, tell us a little bit about your practice, the procedures you do, because you do more than just laser.
Yes, I
dentistry.
do.
Tell me about that.
Well, I graduated from the University of Southern California School of Dentistry.
All right.
My father-in-law went there, as well as my wife, to dental hygiene school. So laser dentistry has kind of been in my blood for a long time.
Is that where you met, you and your wife?
No, we met beforehand when I was an undergraduate. But we have been married now for 43 years and been in Spokane for 30 years. My practice has been there in the same location. And
so you have thousands of patients that you've seen, I guess?
I do. I have a 20-year track record using lasers now, and so I really am an enthusiastic supporter of lasers in dentistry, as are my patients.
Isn't your son's a dentist?
My son is a dentist as well, and he's followed me into the field of laser dentistry also.
7 kids, and only one's a dentist?
7 kids, one's a dentist. I've got 17 grandchildren.
Is that right? Now, why'd you want to become a dentist? I always ask people.
As I said,
like
it's been in my blood for a long time, and I've always been interested in people's appearances, and I know that the smile is a universal form of communication, and I found out when I was in school that I could make a difference in people's lives.
You think the smile is important? I mean, you're a dentist, of course you do.
You know, you wear your smile 24 hours a day, and even though you cover up 85% of your body with clothing, your smile is always out there in front of everybody. So, a smile is a passport that opens doors for people.
Interesting. Do you see in your practice, I mean, I'm sure you got a million stories, but where people that are ashamed of their smile, it holds them back?
We see this all the time. People hesitate to make new friendships. It has an influence on their ability to land a good job. It makes a difference in the perception of others when they see them for the first time. First impressions are very important, and a smile is the thing that gets you in the door.
Now, you're a general dentist, so you do. But you do everything. I mean, you do fillings, you do...
Yes.
Tell me what you do.
As a general dentist, I can do everything without having to refer my patients to other specialists with whom they haven't established a trust relationship. My patients like staying in my office to have their dental needs taken care of. So we do just about everything in the office.
Okay, now I'm always surprised, by the way. You know, I guess, because to me it seems pretty straightforward. But after dental school, I mean, you've been somewhat of a fanatic about continuing education. Tell me about your background.
Well, I've been maybe a little bit of a maverick in the sense in the sense that in 1990, when lasers first became available in dentistry, I was one of the first to come on board with lasers, and really the first in the Pacific Northwest. And so since then, I've been educating other dentists to use lasers as well.
I saw you have this new beautiful red laser. I just saw.
I do. We call it the...
Why do you like laser dentistry so much? I mean, what is it?
Well, you know, I've probably had 15 or 20 different instruments in my office, and I utilize different wavelengths of lasers, meaning I can do procedures to treat almost every dental need that my patients have with lasers. I'm just excited about it because we're always finding new things. New doors are opening up for laser dentistry every day, just as it is the case in medicine. You know, eye surgery was done 20 years ago with a scalpel. Now it's done with a beam of light. And it's really the same in dentistry. Now, instead of using drills and Novocaine and scalpels and creating bleeding and pain and postoperative discomfort, we're using a beam of light to heal tissues. And we're doing it comfortably.
So because of that, there's less pain?
Oh, yes.
Or no pain in some cases?
Well, in most cases, there's no discomfort, and we prescribe just over-the-counter medications following the treatment.
Look for a laser dentist.
People can go back to work after having a procedure in my office without a disruption in their daily routines.
Should you look for a laser dentist, by the way?
Why wouldn't they seek out a dentist who utilizes the latest and greatest technologies? After all, it's the 21st century. Now, dentistry's come out of the dark ages, Randy.
Okay. Now, we're talking about gum disease today, and I guess this laser can almost, and I don't want to put words in your mouth, but kind of wipe it out without surgery.
We use lasers now to treat all forms of gum disease and do it very, very successfully. There's a simple reason why.
Okay.
And that is that the cause of gum disease is bacteria.
Let's define gum disease real fast, because I want to make sure I'm clear on this. So this is something that's under the gum line. It's like an infection.
Gum disease is either inflammation, which very insidiously, subtly leads to infection. And people who have infected gums, it can affect your whole quality of life because there's a relationship between oral disease and systemic disease. That's why you call your show the Wellness Hour. We're interested in total body wellness.
All right, all right. And okay, so with gum disease, by the way, traditionally, you know, I anticipating this interview. Okay, spoke to a periodontist, North American Society of Periodontists. He says, I love lasers. He goes, you know, I think every periodontist, every oral surgeon, and every general dentist in America, and I'm quoting him directly, says that they should be using these lasers in the practice. And I can't see why they wouldn't, because in the old days, gum disease, he says, was not sexy. It wasn't a fun thing to do. He says, now it's fun.
It's fun because it's fun because we can get a handle on it, and with the patient's cooperation, we can cure gum disease. We can reverse the process. We can change their lives, because the major cause of tooth loss in adults is gum disease.
So gum disease.
Nobody wants to lose their teeth. Nobody wants to have red, inflamed, swollen gums.
What are the symptoms?
Well, red gums, inflamed gums, swollen, bleeding on brushing, loose teeth. Certainly pain and
bad breath?
Bad breath, you got it.
Hot and cold sensitivity?
Well, hot and cold sensitivity can be a result of the gum disease when you get recession of the gums around the necks of the teeth, and the laser can treat that as well.
So with gum disease, how is it traditionally done to get rid of this infection, and how do you do it?
Well, traditionally, what happens is the patient is referred to a periodontist, a specialist who treats gum disease.
Okay.
He or she might give anesthetic, and then cut the gums so that he or she can pull them back away from the teeth to inspect the gums in the bone next to the tooth. Then they'll scrape away the infection. Then they'll lay the gums back on the tooth and stitch it up. And then they'll wait for
I've seen those stitches online.
They'll wait for an effective result. After the surgery and the stitches are removed at a second visit, the patient is oftentimes put on an antibiotic to kill the bacteria that have been there all along.
All right.
And then following that, they're monitored by the dentist to see if the gum disease is going to recur.
Is it painful? That's a painful procedure?
And the patient is almost always put on a prescription strength medication for discomfort, because it's quite uncomfortable. It's generally done 1/4 of the mouth at a time, and patients rarely want to come back to have the treatment completed because it was so uncomfortable the first time around. They can't face the prospect of having it done again.
Okay, so the laser. So what is the laser doing that this isn't doing?
With the laser, we turn these kinds of patients into enthusiastic supporters of laser-assisted periodontal treatment, because we can treat most of our patients non-surgically. That is, there are no stitches, there's no cutting with scalpels, there's no second visit, because the patient is simply treated with a beam of light, which gets at the heart of the problem.
So what do? You just kind of pull back the gums and shoot the
laser?
We do.
The laser fiber is only a fraction of a millimeter in diameter. We can fit it right down in between the gum and the tooth to where the bacteria is hiding, and then we can activate the beam of light, which is absorbed by the bacteria, kills the bacteria, problem solved.
So if someone, though, has been told they have advanced gum disease, are they still a candidate for laser therapy?
They definitely are a candidate. As a matter of fact, we always give them a non-surgical option, which they invariably take, because it means that it's going to be less invasive and it's going to have a better result. Because what happens is we take the laser down into the pocket, kill the bacteria. That means
what's the pocket? What do you mean?
The pocket is the little cuff surrounding the tooth under the gums, which can harbor the bacteria responsible for the inflammation in the first place. So if a person starts out with just simple gum inflammation of a little bit of bleeding, we attack the problem right from the inception before it gets more involved and gets deeper into the tissues surrounding the tooth.
So advanced gum disease is defined by what?
Advanced gum disease means you've lost gums or you've lost bone or both.
So when I see somebody with a receding gum, okay, or people that have receding gums, is that gum disease too?
That is, and you know, a person can almost self-diagnose their gum disease by looking in the mirror. If they have receding gums, if they have red or swollen or inflamed gums, certainly if they have loose teeth, they've got gum disease.
So you're saying what? Well, what's going on then? So under the gum line, there's what?
Under the gum line, the bacteria is causing inflammation, which is causing all these symptoms. So if a patient has these symptoms, they shouldn't hesitate, because to wait is only to allow the process to get worse.
But you still, I mean, with early stages, by the way, and I'm a limited research here, so if I'm wrong, you got to let me know, that on early stage gum disease, okay, so they have, you know, bleeding gums, bad breath, things like that, that how it's normally done is they'll scrape that out, and in some cases, because they pull the gums away from the teeth, is that right?
That's right.
And then they may have to stitch those back up.
That's right.
Okay. You're saying with a laser, you just go in, you shoot the area, and it kills that infection.
You know, everyone...
Do you still have to scrape stuff, though?
Well, sure. I mean, the buzzword today is minimally invasive. The buzzword is conservative care in medicine and in dentistry. And the epitome of that is using the laser in the treatment of gum disease, because you're exactly right. If there's any area in the mouth that has inflammation, and you know when there's inflammation because your gums bleed or they're red or inflamed, there's discomfort, we attack those areas with the laser in a very conservative way. And we can stop the process dead in its tracks so it never gets worse.
Do you think it prevents tooth loss?
It prevents tooth loss because the laser has another unique property, and that is it biostimulates the gums to heal at the cell level. So in a very patient-friendly way, without using a lot of drugs, you can help the gum tissues to heal from the moment you use the laser until the patient is seen at the next visit. Frequently, in a general dentistry practice, if the laser is not used, the gums might be scraped, there might even be surgery, and 6 months later, the patient is in the same boat.
So you teach other dentists about this?
I go around the country.
You said I travel 70,000 miles a year teaching dentists.
I'm probably gone 2 or 3 weekends a month teaching other dentists who are excited and enthusiastic about lasers, and I try to communicate my excitement to them as well. I'm kind of known as the laser fanatic because I've been doing it for 20 years now, and I know what the results are.
So no more cutting. I mean, what's your message? I mean, what to an entry-level guy, dentist, that's skeptical? Randy, I don't know, you know. What do you say to them? They'll watch this show.
I tell them that in dental school they learned how to treat disease by looking at it from within the box. With lasers, we're outside the box. It's a whole new way of looking at things. So I tell dentists they need to get outside their comfort zone and just start treating things in a 21st century way. Okay,
now what about gummy smiles? You say people that when they smile, they have too much gum.
You know, one of the saddest things is for a patient to come in their 30s or 40s and always have been embarrassed about their smile because they show a lot of gums when they smile. And with lasers, we can really, in effect, release the teeth from bondage to the gums. We can just expand their smile with lasers so they show big, beautiful, healthy teeth.
How's it normally done?
Well, it's normally done with a scalpel. And while scalpel surgery is very effective, a lot of patients will not accept that treatment option because it's too scary for them. With a laser, we can do it just with topical anesthetic. We just put a little gel on the teeth. We don't even have to give them Novocaine. And then we can treat the area from cuspid to cuspid, the smile line, in about 30 minutes.
So with bad breath, though, and I'm skipping around here and I'm backing up, what does a laser do for bad breath? I mean, that's the part I don't quite get.
Well, again, bad breath can often be traced to bacteria that's in that neck around the tooth. We call it the periodontal pocket, the gum pocket. And the laser addresses the specific problem that's responsible for the bad breath in the first place.
When you say addresses, what does that mean?
That means that we simply put the laser into the pocket next to the tooth, and we activate the laser, wave it around for 15 or 20 seconds inside the pocket. We kill virtually 100% of the bacteria within the pocket. They stay dead for up to 90 days, and then we withdraw the fiber. The patient's not numb during that procedure. We actually want patient feedback because if they feel any discomfort, we just back off from the power a little bit. The laser is very easy to use. It's very patient-friendly. Then when the patient goes home, within 24, 48 hours, they notice a perceptible difference in how their gums feel. We always make a 24-hour post-treatment telephone call to the patient to see how they're doing. The general response we get is, I can't believe how my gums feel. They haven't felt this way in a long, long time. It's simply because the laser has allowed the gums to tighten up around the tooth. They look healthier. The sensitivity that the patient's had around the neck of the tooth has disappeared virtually overnight. Now they can get up close and personal with their loved ones. They don't need to be embarrassed about kissing their wife or their husband. They just have more confidence. They exude confidence because of the use of the laser. It's almost a miracle.
How is hot and cold sensitivity taken care of with the laser? And what's the connection with this hot and cold sensitivity?
Well, you know, we have patients who come into our office asking if anything can be done about their chronic sensitivity, because we had a patient a couple weeks ago who was drinking through a straw. They couldn't drink hot coffee, they couldn't drink cold sodas, they couldn't even eat cold salad. We have joggers who can't run in cold weather because the necks of the teeth are sensitive. They're breathing through their mouth. It's excruciating. The laser can be used to treat that sensitivity, and obtain almost instantaneous relief. We have young people, for example, who come in.
So it's because of the fact, so the cold liquid is leaking into the root, and that's what's, or the nerve, or what?
The cold liquid just touches the neck of the tooth, and that temperature is transmitted through to the pulp inside the tooth.
So by hitting it with a laser, what?
By hitting the laser, it desensitizes the tooth. And we have patients who will come in where you can't even blow cold air on the tooth. They can identify the spot where the sensitivity is very easily. If we use the laser, over the course of about 2 minutes, by increasing the power intensity of the laser gradually, after 2 minutes you can blow that same cold air, and whereas the sensitivity level was a 10, now it's a 1 or a 2. It's remarkable.
In your office, I mean, drilling and things like that, I mean, everything's done with a laser now?
Well, we for 10 years now, we've had lasers that take the place of the drill. The ethical question we have to ask ourselves is, do we need to put a drill on a tooth? And the answer is no.
Really?
If we treat teeth early enough with lasers, I have patients in my practice who started out 10 years ago as pre-adolescents, and now they're in their early 20s. They've never had a shot, they've never had a drill put on their tooth. We've treated cavities, but we've done it very conservatively by using lasers. We even use lasers to identify decay. We listen for decay now instead of probing for decay. Have you ever?
What do you mean you listen for decay?
We have a laser that'll actually shoot a little beam down into the tooth and tell us if there's decay. And the patient actually holds this instrument.
It tells you, there's a reading on
There's a reading, and it also gives you an audible beep. So the patient will hold this instrument in their lap. We'll take the probe and probe each of their teeth. If it makes a little beep, the patient will actually say to us, oh, I think I've got a cavity. We call that co-diagnosis and co-treatment. The patients participate in the process of identifying the decay, and then it gets better. We not only have the technology to identify decay at its earliest moment of inception, but we also have the technology to treat the decay as conservatively as possible, and we do that with the laser that you just mentioned. The laser is actually used to eliminate the decay within the tooth.
So no drilling, no scraping. I mean, your practice, how is it different?
Well,
than other practices.
That laser,
all the stuff we're talking about?
That everything, we call our office the Center for Advanced Dentistry.
Yeah, what does that mean?
And what that means is that we're always looking for something new, some new approach to treating dental problems, really oral health care problems. We treat gums, we treat bone, we treat teeth, all the tissues within the oral cavity. And so when patients visit our practice, they often will say, what's new? They're just not just asking that question to pass the time of day, but they really want to know, because they know our practice, to find out
they know that you are always
they want to know what's new in the practice. And we always try to find out through continuing education what is new so we can incorporate it into their care.
We're going to take a quick break. We come back, the process for gum disease. So no more gum disease in the future. Is that right?
I think that's a realistic goal.
That's possible?
Yes.
That's possible? Procedure for procedure. Does it cost more to go to a laser dentist?
That's the beauty of it. I've never raised my fees for doing laser dentistry.
So it doesn't cost more to go to a laser dentist?
It allows me to do better dentistry, and it allows the patient to feel better about going to the dentist. All of us go home at night and sleep better.
Okay, good. We're going to take a quick break. We come back. For the person with gum disease, I want you to take me through that process.
Okay.
What it looks like and feels like. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about gum disease, new breakthroughs in the treatment of gum disease. We'll be right back. You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about gum disease today, new breakthroughs in the treatment. According to my guest, Dr. Hudson, I guess one of the pioneers in laser dentistry. Is that fair to say?
Yes.
Probably one of the first guys, I guess, in your area to
That's right.
Have the you teach other dentists all over the country. So the days of the drills, the days of those things are almost behind us.
It is.
Is that true?
That's right.
So the laser can be used, and I want to do a recap. Hot and cold sensitivities, bad breath. What am I leaving out? Gummy smiles.
Well, I'll tell you what. One important thing is the treatment of cold sores or canker sores. It's really the bane of a person's existence to get a cold sore. You know you're going to have to go through a 14-day course of having an ugly blister on your lip. With a laser, the amazing thing is if your lip starts to tingle, you know you're getting a cold sore. Come into my office, have me use the laser on it. It's comfortable. There's absolutely no...
How long does that take?
It takes about 3 minutes to treat the cold sore, and it will never break out. You'll never erupt with the cold sore. If you don't...
Are you allowed to say that?
Oh, yeah.
That'll kill the... whatever's going on?
Absolutely. It kills the virus responsible for the outbreak in the first place. And the good news is that patients tend to get them with less frequency and less intensity after the first visit. So if you get cold sores chronically, the laser is the way to go. Nothing else will work as well as a laser does. The stinging sensation associated with the cold sore or the canker sore is gone almost immediately. It's remarkable. We get testimonials from our patients all the time about the effectiveness of the laser use with cold sores. As a matter of fact, if I only had a laser to treat cold sores and canker sores, I'd still have a laser in my practice because it makes such a profound change in people's lives.
And it doesn't cost more to go to a laser dentist.
Absolutely not. The good news is...
Because these machines you have are almost like $100,000, right?
I'll tell you what, the good news is that laser dentistry is covered by insurance plans as with any other dental procedure. There's no additional fee for using the laser in the office, and it's universally recognized as a viable treatment option, and so third parties pay for it all the time.
And it is FDA approved?
Absolutely.
For periodontitis, for periodontal disease?
You know, it's interesting, yeah. FDA approval just means that the laser needs to be equivalent to other treatment modalities, and it's certainly proven to be that. As a matter of fact, it's superior.
And we're just about out of time, but people that are watching this, okay, and you told me at the break that there's a lot of people out there in Washington that you think are serious or depressed or miserable. Maybe they are.
Because of their smiles.
They don't like their smile.
That's right.
So what do you say? What do you say?
I tell them that life is too long not to have a smile you're proud of.
Okay.
And it's never too late to come into the office to have what we call a smile design analysis. One of the first things we do with a new patient is evaluate their smile, listen to what they're telling us about what they don't like about their smile, and there's almost always a solution to their problems.
Which is the laser.
Which is the laser. The laser is incorporated in the process.
I know you do veneers and things like that.
Well, you know,
it's part. I mean, is it part of a regular cleaning as well?
Well,
you go around the mouth with a laser.
For sure. You know, I've been a general dentist ever since I graduated from school, but for the last 20 years, I've characterized myself as a laser dentist. So everything I do has a laser component. So as you say, when you clean the teeth, you always use the laser because 85% of our patients have some form of inflammation.
So because it kills the bacteria.
Because it kills the bacteria, stops them dead in their tracks, and without viable bacteria, you're not going to have a progression of your gum disease.
What can the experts say, by the way, about what you're saying? Would they agree? I mean, is what you're saying completely controversial? Are there dentists out there that say, no, I don't buy it?
It's interesting. The experts who have spent the time to educate themselves about lasers themselves become enthusiastic laser advocates. It's becoming more and more mainstream. Cost has kept people away from purchasing lasers because there's a significant startup costs. The educational requirements are also significant. Continuing education to learn more and more about laser dentistry is important as you go down the road. So these things keep people from incorporating into their practices. The reality, though, is that when a dentist incorporates a laser into his or her practice, they become enthusiastic about the use of lasers and become advocates for laser dentistry.
Your teeth, I'm looking at them, by the way. Those are beautiful teeth of yours.
Thank you.
And so how often do you go around your mouth with that laser?
You know, the answer is as often as necessary. As I said, we
like every 6 months?
We fashion a treatment design tailor-made to each individual's circumstances. Some people need to come in 4 times a year instead of twice a year to have their laser dentistry done. But it's not often that they come in more than a couple of extra times a year.
But do you do it about twice a year?
Oh, for sure.
Yours?
Yeah. You know,
are you excited about it? I mean, when you're 95 years old, do you think your teeth will look that good?
That's a good point. You know, I'm at the age group now where I need to be careful about my gums and the bone that support my teeth, because I have all of my teeth, thank God, but I want to keep it that way. And the only way to keep them that way is to do the kinds of things that we've been talking about during this interview.
So I know, you know, with lasers on the face, that when I talk to dermatologists, it hits the skin and then the body produces more collagen. So when it's hitting the gums, same kind of thing. I mean, it's making them stronger.
You know, people who have invested in cosmetic procedures of any kind will probably find that their plastic surgeon will use a laser. They do it for very good reasons, the same reasons that dentists use lasers. It stimulates the cells to heal themselves. So instead of identifying disease and cutting it away, we identify disease and heal it with a beam of light.
So kids, okay, so cavities, but we're out of time. But so 17, 18, 19-year-olds, you can go around the mouth lightly with a laser, kill any bacteria.
You know, a young person won't have the kind of profound gum disease that an older person will, but that older person started out as a 17 or 19-year-old with a few areas where there was bleeding gums. If we can hit it at that moment, it'll never progress to the stage where it causes a real problem.
If they've been bleeding for a couple of years, you're saying you could hit it with the laser, get the bleeding under control, wipe the bleeding out, If you catch it early enough.
That's right.
Do you see reversals like that every day?
We do every day because the bleeding of the gums in an otherwise healthy mouth is the first sign of gum disease. And if we can stop that, you'll never get the loss of the bone, the looseness of the teeth, the red swollen appearance of the gums. And so if we start early intervention is the key.
Do you ever get patients that come to you, and we are out of time, but that come to you and say, Doc, I bet you've never seen a mouth this bad?
We like seeing patients like that. It happens all the time.
Really? They say that?
Patients will come to us almost in desperation because they've neglected their teeth for so long, thinking that there was no viable alternative. There's nothing for them that could help. They may have even visited another dentist or two, and they come to me for a second or third opinion. When they come to me almost as a last resort, that's the kind of patient I like to see, because those are the people where we can see a reversal in the process. We can actually save their teeth. We can turn them into patients who have healthy, vibrant smiles, who are once again enthusiastic about life.
So wipe out this infection with the laser. The gums get better, the teeth get stronger, and then life is good.
Oral infection can really be a downer on life, and life is good afterward.
Okay, good.
I mean, my philosophy is, why settle for less? Why not settle for more?
Well, thank you for coming to the show. Great stuff.
Thank
Sorry
you.
we're out of time. They can find out more on your website, and we'll feature this on our website as well.
Thank you.
And so I guess if you have these symptoms, make an
The
appointment.
best thing to do is to come in for a consultation
You'll
so we
meet
can
with them?
determine what needs to be done. Absolutely. It's a 2-hour visit when we really get to know each other.
Okay, good. I want to thank you again for coming in.
Thank
You've
you.
watched The Wellness Hour, the leader in medical news information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com and just put in laser dentistry. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.